you're looking for your nearest Y-strap doctor, just visit my website, drjosephcipriano.com. Put the tab locations and you'll be able to find doctors that perform the Y-strap adjustment near you. And if you're a fellow chiropractor out there watching and you use the Y-strap also, visit the site, find out how you can be listed on here as well. Let me have you kind of tell everybody today what's going on, who you are.
My name is Jillian Beth, and I'm here. I found you on YouTube, which I was really excited about, especially since I recently started a YouTube channel.
Yes.
And I came because I've been noticing a lot of just like tightness here and in my neck. And then I've always had more of a problem with my lower back and hip area.
Okay.
Not sciatica.
Just low back.
Low back, and there's like a little ball back there that I don't know if that's normal or not. And just feeling overall like tight. Okay. And after watching your videos, I really just wanted a chiropractic adjustment.
Well, obviously you came to the right place. Now I know you have a channel as well. What do you do on your channel? I know it's all about like women empowerment.
Women's empowerment, yeah. I'm a women's empowerment coach, and I do intuitive healing, so a different kind of healing. I'm more energetic, but mostly empower women and have cool conversations, so.
Definitely check her out. We'll have everything
Jillian
listed.
Beth.
We will have everything listed.
Thank you.
Let me have you stand up. So let's go through some ranges of motion first. We'll start up in the cervical spine. I want you to look all the way up at the ceiling for me. Any pain, tenderness, tightness, pulling, anything like that? Good. Look all the way down to the ground. Any issues with looking down?
It just feels a little tight on my neck.
Okay. Alright, back to center, and then bring one ear to one shoulder. Any issues with that? And then to the other side.
It feels a little tighter on this side, but not like super painful.
Okay, and then if you rotate over either side, any issues with that? Okay, good. Now we're going to drop down, we're going to do the lower body. So I'm going to have you bend forward at the waist for me. Any pain, tenderness, tightness, pulling, anything like that?
It just feels a little bit tight back here.
Okay.
That's about it.
And it stays in the back, it's not traveling down.
It stays in the back.
Okay, and then if you extend back like this.
No, that actually feels fine.
It feels good?
Yeah.
I'm going to have you lean into one side. Any issues there?
No, but did you hear that
I
crack?
heard that crack.
Something's ready to crack.
And the other side.
I feel it in that spot in my lower back.
Okay.
Yeah.
And then I'm going to have you rotate. Any issues with rotating?
No.
No,
There was
okay.
another crack.
Have you been adjusted before?
Yes. I think twice in my lifetime.
You think?
Yeah. In the last, once because like I couldn't stand up. I guess my lower spine was out of place, but that was like literally 20 years ago. And then the last time I went was probably 10 years ago.
Okay. So it's been a while.
Yeah.
So today is going to be a little bit different. Yes.
Yes.
Alright, I'm going to have you lay face down for me. And then I'm going to have you bring your hands right down here. Good. Alright, so we are going to start off. We are going to scan the body. We're going to go from the cervical spine. And we're going to make our way all the way down, checking the leg length. Then we're going to check that symmetry from the right side and compare it to the left. So I'm just going to be palpating and pushing in. Let me know if anything is tender when I push in, okay? So I start in that cervical spine, make my way into the thoracic spine.
Ooh.
Soreness up here?
It cracked.
Good. So she's already getting a little
No
cracking.
need for you. Self-adjuster
Alright,
here.
you're done.
I'm making it easy
Next.
for you.
Alright, we're going to keep making our way down. Definitely feel a lot of tightness.
Yeah. Oh, yep.
Okay, so they're right at that lower lumbar spine. Now when we get to those SI joints, any pain over that right side?
I mean, it definitely feels like tight, but it's not painful.
Okay. What about directly over the sacrum?
No.
Okay, good. And then over that left SI joint?
I just feel it across my
the
whole lower back.
Okay. And we're going to come down here. Let's take a look at the leg length here. So as you can tell, she's pulling short on that right leg by a good amount there. So now when we scan up the body, so the right hip is a little bit higher up, but what I do notice, So there's a little bit of curvature in here. So I'm noticing it's starting here. Hold on. I'm gonna lay a model spine on your back. Just let's kind of show everyone what's going on here. So it's starting in the lower back. It's going up. It is doing one of these right here. So, and it's rotating like that. So as you can tell, on that upper right portion of the back, it's a little bit raised up. As you can tell, the transverse processes where the muscles are attaching to appears if it's raised higher than the other side. Through this middle back in here, it's a little bit raised up as well. And then in the lower back, all the way down here, it's raised up a little bit too. So granted, I'm over showing like a scoliosis here. It may be a lot lighter of a degree, but I'm just kind of showing you what's going on internally actually. So let's go ahead. We're going to use the massage device and we're just going to relax everything first. And then we'll start with the adjustment. Right? Alright, so we're going to go ahead and start with the adjustment. Okay, and we're going to start with the T3 on that left side up here. Drop down to T2 on the right. Good. And you feel how that just opened up those nerves, took a lot of pressure off there. Okay. Take a deep breath in. And exhale out. Good. Deep breath in and out. Good. Come down here. Let's recheck that leg length. So that right leg that was short, it's better. Still a tiny bit short, but actually improved by quite a bit. So let's have you sit up on the table. And I'm going to have you straddle the table, so one leg on either side.
Oh my gosh.
Alright, so let's have you bring this arm up and over, and that arm up and over here for me. Good. So with your thighs, I want you to keep your thighs to the table. I'm going to rotate you this way. And I want you to look over the shoulder for me.
Okay.
This last one, good. And I got a little lower one. Yep, so we're going to go to this side. There we go. And lay face down again for me. Pretty good, huh?
That's good though.
Good. Alright, we're going to recheck that leg length. Almost perfect.
Yeah.
Almost exactly perfect now. So we're going to drop down here to the sacrum. We're going to stabilize right on the sacrum. I want you to raise that right leg up for me. Any pain, tenderness, tightness with that?
Just a little tight.
Okay. And then raise the left side. Now how does the left side feel compared to the right?
Looser.
Okay. So I want you to cross the bad leg over the good leg. Good. And so...
Oh, I know this one.
Yep. So the table is going to pop up from the hips. Alright, so what's happening is her sacrum is pointing more towards that left side. So what we're going to do, we're going to do a P2a adjustment, just meaning from posterior to anterior. And we're going to put a counterclockwise torque on the sacrum so we can bring it back to midline. Our neighbor doesn't like us.
I was like, what is that?
And I'm going to have you bend this knee.
I want you to like purposely do that now.
Yeah, we're going to do this, yeah.
That's comical.
Isn't that hilarious? And we'll get two more on purposely.
Yay, me.
Good. And down.
Lovely neighbor we have.
Mm-hmm. Re-raise that right leg up. How's that feeling?
A little more loose.
Alright, a little more loose. Alright, so now we're going to work on the lumbar spine. So I'm going to have you lay on your side, face me this way.
They shouldn't, like, tell people over you.
Oh, I know. Ridiculous. I'm just going to drop that shoulder.
Okay.
Good. Good. And I'm going to have you flip to the other side for me.
Which way?
Yeah, we're just going to drop that
Which
shoulder.
way? There we go.
There we go. Lay flat on your back. Okay, from here, I just want you to relax your legs. We're going to do leg pulls here.
Okay.
So you'll feel some release in the ankle, the knee, going up to the hip. Good.
Under my ankle.
Alright, and I'm going to have you stand up. Good. And we'll have you stand right here in front of me.
It takes a minute to like settle in here.
Alright, I'm going to have you bring your arms out to the side. Yep, up and over. Good. I'm going to have you lean back, squeeze your elbows together. Good, good, good. There we go. Feel that between the shoulder blades? Good. And I'll have you take a seat right here, facing the wall that way. Good. Okay, bring one arm up and over, the other one up and over. So with this, I'm going to have you take a deep breath in and exhale out. There we go. Okay. So now, you're going to do the Y strap.
The infamous Y strap.
Alright, I am going to need a little bit of help with your hair here. Yep. Thank you. Perfect. And then just relax, hands on your stomach. And you're going to feel that decompression from up top, just going all the way down. And breathe. Deep breath in and out.
Oh my gosh. I didn't know I had so many bones I could crack here.
Now, how would you describe that Y strap?
That's the question. I don't know. I feel like my head is back probably where it should be. That was incredible.
Right?
I don't have much other words for it, but you should definitely do it.
Good. Feeling better?
Yeah, it literally feels like you lifted my head back into place, basically.
Like into alignment, yeah.
Yeah. Wow.
Good. I'm going to have you sit up. I'm going to have you turn and face that way for me. So what I'm going to have you do, take this arm, put it behind the small of your back for me. Yep.
I feel like I'm still coming back into the room.
Switch arms. Thank you. How do you feel?
Amazing.
Let me have you stand up.
I like that too. Like,
it's powerful.
it loosens, like I could just feel myself like relaxing into it.
Oh yeah.
Very good.
That's why, I mean, you gotta realize your muscles are connected onto your bones. So if you have a muscle that's taut and tight and pulling, it's gonna pull your spine, it's gonna pull whatever it's attached to, it's gonna pull it out of alignment. So when you relax the muscles, you put the spine back into alignment where it needs to be, then you relax those muscles, your body will actually hold the adjustment longer than expected.
I feel like my head is still trying to figure out its new placement. That was good.
Good.
Very good.
Let me have you just look up, look down. I know you didn't have like crazy amounts of pain. I know it was a little bit more, like when you look down you had more tightness, I remember.
Yeah, I don't even feel that right now.
Don't even feel it?
No.
Okay, and then to the sides.
It feels good.
Good. And then bending forward, bending backwards. Any issues with any of that?
No, in this I don't feel anymore, whereas before I could feel it was more tight across the back.
Yeah, that's like directly across.
Yeah. Oh, that feels fine. Oh my gosh.
Was it worth the trip?
Absolutely. You guys are amazing.
Thank
Like,
you.
I'm so glad I came. Definitely recommend him.
There you go. I don't need to say it. I mean, you guys see it not just on her face, but any and every patient that comes here.
Yeah.
They come in, like you came in, I know it wasn't the craziest amount of pain, a lot of tightness. You did have that low back pain though.
Yeah.
And even as simple as an adjustment.
Because it's important for like our overall health, right? To
Mhm.
to do something like this. I'm
Yeah.
so glad I came.
Yeah, because you got to realize, the whole point of chiropractic, what we're doing is we're removing pressure off the nerves so we allow the body to heal and to function, as it's intended. So I know you don't always have to feel pain when there is pressure on the nerve, but once that pressure is removed, like you probably didn't even realize just how much better you're
Yeah.
overall feeling.
Yeah.
So
It's like the chocolate cake you didn't know you were missing.
guys, literally I put my name on the wall so you know exactly who I am. Literally go to drjosephcipriano.com. Send me a message and I'm telling you, issues and pains that you're dealing with, you don't have to live with these issues. There are ways out there where you can, help relieve that pain, and this is why I post these videos so you guys can see what I do and how I help people. So send me a message and I'd love to help you out, guys.